is Evans. I am the office manager here at Hope Matters International.
I'm Bramwell Meli.
Hi, my name is Mercy.
Hi, I'm Hilary Kibet.
Hi, my name is Daniel Musobo.
Yes.
This is Michelle Kiprope. I'm here at the Village of Hope Hospital today. I just wanted to share a little bit of the background about our ministry here. I've been serving in Kenya for 13 years now, and as I was serving in a rural setting, I started realizing there are so many patients that are falling through the cracks and that don't make it to a hospital in time, or they come to the hospital and they're dying, and there's something that could have been done in advance that didn't get done. And so my husband and I sat and talked and prayed and looked at what could be done, and the vision of Hope Matters was born. We've also often been asked why Hope Matters. You know, there are so many ministries with the name Hope in them. Why hope? And as we talked about it, we said because hope is important, and without hope, you have nothing. And one of the things I've seen and experienced is that African people have an ability to hope even in the worst of circumstances. And I love that spirit that is so resilient. And we've learned through healthcare, there's times when we can cure people and we can fix the problem. And there's other times when we can't fix everything, and there's problems that won't go away. And yet there's still hope. And there's always hope in Christ. And so that was how we came with the name Hope Matters, because we believe there is always hope in Christ. And if you're holding on to that hope beyond this world, then you can take everything else away, but you still haven't lost everything. So here at the hospital, we just moved into the hospital earlier this year. This has been a vision for many years in coming, so it's been very exciting to be here. We are already providing outpatient services, basic treatment, 24 hours a day. Patients can walk in at any time for urgent care. We also have maternal child health, where mothers can come for prenatal care, babies can come for wellness. Then we have the continuity of care, where we do the ultrasounds here, so we're able to screen and detect any challenges. We're also delivering the babies here. So we have babies being born around the clock. There's always staff here to receive if any patients are coming. We also have a physiotherapy department that has recently opened, which has been such a blessing. Seeing everything from children to older adults. Our physiotherapist is amazing, stepping in and helping anywhere that a patient needs assistance, from massage to therapy to walking and trying to regain mobility after a stroke. So we're really blessed by that department. We also have pharmacy so that we can see the patient. We can prescribe the medications here, and they don't have to go somewhere else to get to their medicines. They're here on site. We also have laboratory service for the same reason. We want to be a one-stop place where the patient comes, they're able to see the clinician, they get the diagnostic tests done, and then they're able to receive the treatment at the same facility. So we are currently doing basic admissions, where patients that need to be admitted to the hospital can be admitted and served overnight, or even for several days if need be. We're looking to the future. We're really looking forward to being able to open our operating theater down the line, so that we'll be able to provide C-sections here, that we'll be able to provide trauma surgeries here, and eventually have an ICU as well. So we're not quite there with the ICU yet, but it is the vision for the future. One of the things that we feel is really, really important about our facility is that we are here not just to treat the body, but to treat the soul, to treat the spirit. So we have a chaplaincy team, not just one chaplain, but a whole team that are here to provide spiritual care for our patients. We also believe strongly that we don't need to wait for the patient to come to us. So because of that, we have an outreach team that goes out into the community and engages at the community level with patients and goes to where they are. Even this last week, we were able to detect some patients that desperately need care that have never actually been to a facility. 7 years struggling with a chronic issue that could have been cured with basic treatment right off the bat, and at least can still be helped. But we wouldn't have even known about this patient if not for our outreach team. So we have public health officer working together with our nurses, working together with our chaplains to go out into the community and to find those patients that need access to care that are not getting care. So we really believe in going out, spreading out, not just waiting for patients to come to us, but going out, finding them, bringing them to us, and then providing the care for them here. In our laboratory, we're able to provide tests now that you would normally have to travel more than an hour away to get access to. So that's been really exciting to be able to do a complete blood count, where in the past it was just a hemoglobin. If you were in the rural area, we couldn't actually know what was your white cell count, what was your full complete blood count. We're able to test the liver now, test the kidneys, and do much more comprehensive care than we could in the past. And so our goal is to truly be able to provide quality at a very affordable price, because we are here to serve the poor. We're not here to get rich. We're here to try to make a difference. So as we are here serving, we do have some pretty big needs that we're looking at right now. As we want to get that operating theater open, we need an anesthesia machine, which is going to be a key point to getting the operating room open so we can do those C-sections and save those babies. We're also really looking at getting our neonatal intensive care unit open. We've had several cases recently that have been truly heart-wrenching that we have been unable to care for because we didn't have the capacity, and we've had to refer those babies on to a unit that is so overloaded. It's serving multiple counties. It's the only neonatal intensive care for quite a distance, and so babies are waiting in line for ventilators. Babies are sharing incubators, 3-4 babies in an incubator, and we've lost several of our babies that we've had to refer to that facility just because we weren't able to do the care that we knew that needed to happen. We didn't have the equipment and we didn't have the right personnel. So we are really praying that the Lord will provide for us to be able to open that neonatal intensive care unit in the next year. So that's a huge one. Getting the operating theater open is a huge one. The needs are great. You know, Jesus said the harvest is plentiful, the workers are few. And one of the amazing things about doing healthcare in Africa, we have the freedom to share Jesus with our patients. I can't tell you how many times in a week I lay hands on a patient and pray with that patient. And we have the ability to share sometimes, you know, this is a disease that we can't beat, but we have a God who's great, who can walk you through this disease and who can walk beside you. And we have a hope that's beyond this world. And I love having that freedom as a medical provider to speak that hope into my patients' lives, to pray with them, to walk with them, and to encounter patients with the love of Christ that would never walk into a church, but that can find Jesus through their darkest hours. So just encourage you to pray about it, reach out to us. We'd love to talk to you more and even arrange a visit for you guys to come and see the hospital firsthand. Thank you.